Certain institutions are necessary to bring communities from good to great. A great public health institute is an engine for community-level health improvement, helping everyone reach his or her greatest potential. Founded in 1957, we're one of the largest and oldest public health institutes in the country. We connect research, on-the-ground programs, and policy work to address key health issues like smoking, childhood obesity, family planning, getting better food into school lunches, and reducing HIV/AIDS. Our network of partners bridges academia, local, state, and federal governments, and both nonprofit and for-profit organizations. Much of our work is aimed at the highest risk communities, but our efforts and work shape public health outcomes for millions of Americans. While government support helps us run some of the largest public health programs in the country, we currently raise less than 5% a year from private sources. We need to grow that to address emerging opportunities throughout the field. We do some of our most creative work with private funding. We'd like to double our private funding over the next few years, and we invite you to help us meet that goal. For example, through our WIC program, which serves 46,000 clients every year, we have a unique window into what helps families choose better food when shopping, which is a critical step in addressing obesity and can serve as a national model. We've also developed the first computerized app that helps women choose more effective contraception. It has remarkable implications for women's health and creating stronger families and communities. But these kind of innovations don't receive government support. We need strategic philanthropy to help bridge the gap. We look for points that facilitate our ability to accelerate, test, and scale new ideas in public health. For example, our school food reform program has already reached millions of children. Chicago has substituted whole chicken for chicken nuggets. St. Paul has moved to whole grains. And Denver has dramatically increased local food sourcing. In this particular area, the lever is procurement change, converting what a school district buys to healthier options. And so we work with federal agencies to improve school lunch guidelines. We partner with nonprofits to engage parents and local leaders. We push school districts to reach higher and make changes faster. And we work with vendors as well as farmers to understand the mechanics of their supply chains. There is other great work going on in public health, but it takes an organization like ours to connect all the pieces and do it credibly and consistently at every level in multiple communities. In what we do, we address a version of this question. Will doing X unlock more value in what we do or what our peers do in public health? Because our specific programs are often distinct, this question provides a useful lens in helping determine what combination of strategies and tactics would be most effective. The issues and challenges in public health are particularly multidimensional. Take childhood asthma. Key issue drivers span environment, housing, immigration, energy, transportation, and healthcare. So, in most of our work, we place a premium on strategies and tactics that reflect a collective impact. We bring more stakeholders and partners into the public health space, leveraging the unique strengths and resources they bring. A terrific thing about public health is that it is outcome and data centered. All of our programs have specific health improvement or related goals. Going back to earlier examples, we recently launched a pilot project in our WIC program to help families choose better foods at the supermarket. We anticipate participants will develop healthier shopping habits and then prepare meals that are less likely to contribute to obesity. Our research team is developing surveys and analysis, and our WIC staff is tracking nutritional data. In our school food work, we partner with federal agencies to improve how the impact of school lunch is measured, to emphasize health outcomes rather than just the number of meals served. And our contraceptive app illustrates the rigor of our work. We have tested it in our clinics among historically hard-to-reach, low-literacy populations and the findings have been examined closely and published in peer-reviewed research journals. Because we are one of the largest public health nonprofits in the country, the size of our budget often creates a misperception that we do not require additional private funding or contributions. However, we don't have an endowment, and more than 95% of our budget comes from very specific government grants and contracts. Because of the size of our service delivery programs, we have the ability to quickly mobilize the thousands of clients that we have to participate in research and evaluation projects. And the findings not only improve our programs, but advance knowledge throughout the state and the nation. That combination means we're very uniquely teed up to leverage the assets from large-scale government-funded programs to develop new ideas and projects. But we have a fairly small amount of unrestricted seed money toward that end. For us, private money has often been used to test innovations that have gone to scale with government grants. In much of the country, a public health institute often makes up for the gaps in governmental public health. We have a unique legacy of accomplishments because our role has been different than governmental public health. In the early 1960s, we led groundbreaking research on pulmonary disease and air pollution. In the 70s, we helped expand Title X family planning services and integrate other services such as WIC and food stamps. In the 1990s, we began what is now a 20-year role in managing New York's HIV/AIDS services. Since 2000, we began research projects and programs to address childhood obesity. We also launched pioneering efforts in video interventions in 2 areas. HIV Big Deal is the first evidence-based HIV prevention online video series that has been shown to increase testing and disclosure. Our infant feeding DVDs, available in multiple languages, lead to less early childhood obesity. These programs have been successful in changing behavior to improve health outcomes. A very recent challenge confronted our MIC Women's Health Services program, which had long been one of the leading prenatal and family planning providers in the region, offering comprehensive high-quality family planning and prenatal care to almost 12,000 women annually. Because funding shifts at the federal and state levels had greatly accelerated pressures on traditional women's health and family planning centers, we found it necessary to examine new options for sustaining the core of our MIC enterprise and its care model for the coming years. We partnered with a federally qualified healthcare network that had a large geographic and population overlap with us. We transitioned a number of our clients and clinics to them, creating as close to a win-win situation as possible. The federally qualified health network increased the number of clients it serves and centers it operates. We were able to shift our care over fairly seamlessly. We avoided major gaps in service to the community, and our patients will receive more comprehensive care under the new arrangement. First, we want to bring our contraceptive app to market across mobile and web platforms. This is a timely, proven product with potentially broad range of impact for millions of women. It can be used in many different settings, including with low literacy populations, using touchscreens and multilingual audio. Second, we are rolling out the Upper Midwest Learning Lab, the first regional effort for our school food program. By working at this scale, we will be able to strengthen regional food supplies, leverage infrastructure investments from the USDA, and address a broader group of foods on the school lunch tray. Will likely impact almost 9 million children over 3 years. We also have some projects in the alpha stage, including a new research project on the economics of food retailing, so we better understand how to increase healthier foods in communities. And R&D to bring HIV Big Deal to mobile platforms so we can better micro-target HIV prevention efforts. We like to provide technical assistance to other nonprofits doing health and human services. We think we've been able to design our programs in such a way and evaluate them in such a way that they make a very big difference in public health. We'd like to help others do the same. And we would also like to translate our abilities in information management and evaluation to the broader human services area. So groups are not just measuring widgets, but actually the outcomes of their work at the client level.